The greatest burden of sickle cell disease is in sub-Saharan Africa, where access to medical care and public health strategies to decrease the mortality and morbidity are not uniformly available. Over 300,000 babies are born with SCD annually between 2000 to 2021. The total global birth increased by 13.7% to 515,000. Nigeria has over 40 million carriers of sickle cell gene, with an estimated 150,000 babies born every year with a condition, with at least 100,000 babies dying before their 5th birthday. With the rise in the record of death of babies and adults, the significance of managing and avoiding the dreaded sickle cell disease has come to the fore. Hence, the commemoration of World Sickle Cell Disease Day with this year's theme, reducing the burden of SCD in our communities, advancing new treatments. It's Healthy Living on Trust Television. I am Aisha, Salihu. Let's cross over now to take some insights and perspectives from our experts at the Sickle Cell Disease Warriors. Thank you so much, Doctor, for joining us on the program.
Thank you. You're welcome.
Now we're looking at reducing the burden of SCD in our community, as suggested by this year's theme, advancing new treatments. I'd like to first of all hear from you the level of the burden of sickle cell disease in Africa and especially in Nigeria at the moment.
Nigeria at the moment, we have about 200,000 of new births who are sickle cell anemic patients. So every year, you have about 200,000 of them being given birth in Nigeria. That's a burden as we speak today. Yeah.
So in looking at management, earlier you talked about treatment. I'd like to hear more elaborately on treatment advancement and how it has been effective in curbing or at least managing these cases.
Okay. Now, basically in the treatment of sickle cell patients, we have the medical treatment in which we hydrate the patient, we manage the pain, and then we treat for infection. Now, you have to ascertain what is causing the crisis. When you know what is causing the crisis, you remove that. You go to handle, the condition you found your patient. Now, the advancement we've had so far is what we call the stem cell transplantation. The stem cell transplantation, what you try to do is to kind of radiate the bone marrow of the patient, get or harvest the bone marrow from a person who is normal now and transplant it and or infuse it into that normal patient. And we expect it to graft, and then the patient becomes a normal patient without crisis. And we can do that in Lagos, in the Sickle Cell Center today, or we can do that in Benin. There's a center, a private center in Benin where this has been done. And then we have the genetic engineering, and that's what you call the genetic engineering. When you do that, you're going to the genes and to change the mutation that has taken place in the gene of that particular person. Okay? Trying to change everything, because what causes the sickle cell is a mutation in the gene of the hemoglobin.
Okay. Now let us look at drugs now. I'm aware there is hydroxyurea, folic acid, pallodrine, and penicillin injection. I'd just like for you to walk us through all of that.
Okay. Now we have what we call the routine drugs we give to them. Because these patients are anemic, they have what we call chronic anemia. We give folic acid to them. The folic acid helps in building up the red cells of these patients. The pallodrine we give to them is to help them against malaria and infection. Okay? And then the hydroxyurea, it's a drug that's been used, from new modern form of treatment to increase the level of fetal hemoglobin in these patients. And when that is increased, the rate of frequency of crisis now reduces. Now, the penicillin V that has been given is to help to boost the immune system of the patient, because these sickle cell patients do not have a spleen. And when they don't have a spleen, they are prone to coming down with infection because their immune system is down. So the penicillin V helps in boosting the immune system of these patients.
You talked about increasing the level of fetal hemoglobin. I'd like for you to, earlier you also stated how with the increase of the fetal hemoglobin, these crises can be constantly reduced, and we may somehow say this person is no longer presenting with major crisis and all of that. I also like to hear from you the role of newborn screening.
Fine. The newborn screening, when you do the newborn screening, it helps you to know how to manage, you know, the sickle cell patients when you get them at the newborn age. Now you do that with cord blood. You give birth to them, you collect the cord blood, and then you screen them. And when that is done, you begin to plan. If the patient turns out to be an SS, you begin to plan the management of the patient. And when you do that, you help the patient to become at least pain-free in his life. But you see, when we don't do that, we allow them to go. Now you have to discover that someone is a sickle cell patient, maybe at the age of 10, age of 5. Sometimes the damage must have been done, you know. But when you do that early, you can be able to follow the patient, you know, as they grow.
So we have been talking about sickle cell disease and how we need to combat it so we don't keep recording more cases. I'd like to hear from you, what has been the challenges that you have had to face?
Most of the challenges I've had to face as a warrior is I tend to have limits to the things that I do. That's like one of the major challenges that I face, because I cannot exactly do everything other people will do, because first of all, my immune system is low. If I overwork myself, I fall sick easily, and then most times to get to medicational centers, sometimes it's not really available for me. So those are like most of the challenges that I faced when it comes to my health condition. Yeah, that's just it.
Okay, so I'd like to hear the medical complications you've had, but first of all, let's do a background of growing up till now.
Okay. Growing up, I'm from a family of 7. So my mother was able to make sure that we found out that we knew our genotypes right from really young ages. I found out I was sickle cell at primary 5. I think I was at the age of 7 or so. So I've been able to learn the things that my body adapts to and the things I shouldn't be doing. You know, growing up, it's been at first it was hard for me because I felt like they did not give me a reason to not do the things that I wanted to do. I wasn't able to play ball, I wasn't able to swim, and I really like dancing, so like I wasn't able to dance. But when I learned it and eventually I started growing, I realized that it's not as complicated as it is. So like I was able to reach the maximum, and ever since then it's been really good for me personally. Yeah.
So what are the medical complications you've had to deal with even now that you're an adult?
One of the major medical complications I dealt with was avascular necrosis. You know, I had to undergo 2 surgeries on both my legs, and other things I face is you know, the usual malaria, and then every now and then I get a crisis if I overwork myself or if the weather is too harsh. So those are like the medical complications that I face. But because I've been able to understand my body and I've been doing the right things, it's not as bad as it would normally used to be. So yeah, I've been able to balance it.
Okay, I'd like for you to walk us through your access to management techniques and procedures. I'm talking about medicine and also psychosocial support.
Okay, for psychosocial support, I have friends and families who they help me a lot. You know, they can tell when I'm going down the depressed lane. So like they always tell me that I can do it. They always motivate me, and I feel like most warriors should have those type of people around them that let them know that they are not different from anybody else. That's for the psychosocial part. And then for other medical reasons, you know, I've been with a particular hospital since I was a kid, and I've been able to grow a personal relationship with my doctors. And every time I would fall sick, getting access to treatment personally for me has not been so difficult because I have I have access to my doctor at any time. And apart from that, I also have friends around me who studied medicine, who are actually professional doctors, and they also help me out when I'm, sick, or if I need any attention and I can't reach my doctors at the time. So I've been able to create my own space in a way that I can have access to these things by myself.
Okay, in conclusion, I'd like to hear your word of advice and message to other warriors out there.
Like I always say to other warriors out there, you have to have a strong mindset. Yeah, just because you're sickle cell doesn't mean you cannot do it. So if you are able to learn about your body, everything would actually go smoothly. So what I always tell them is you have to create a strong mindset, and if you have a strong mindset, you're going to have a strong body. That's just the key.
Is it possible that one does not present with the sickle cell disease, say, in the early stages of their lives, when they are still little babies, until a certain age? I just want to understand the dynamics around that.
Now, when a child is born, the child has what we call the fetal hemoglobin, as we call it, hemoglobin F. Now, by the age of 6 months, this hemoglobin F is being converted to the adult hemoglobin. Now, the hemoglobin F does not sickle, and that's why you don't have those symptoms. And by the time it's been converted now to the adult hemoglobin, then you have the sickle cell. And the symptoms begin to manifest. Now, you have some patients that do not even manifest at 6 months. They take a longer period of time when there's a persistence of that fetal hemoglobin in those patients. And so they live without no trouble, and then maybe someday they come into crisis, and then by the time you go and test them, maybe the child will be 10 years, 12 years, and say, this patient is on SS. And when you do the fetal hemoglobin, you know the quantity. It's quite much.
Okay, I'd like to know the role of blood transfusion in this, in management, and how effective is it, and also, say, the possible threats or dangers to it.
Now, as I said earlier on, we don't really advocate blood transfusion in every sickle cell patient. Before you transfuse the patient, there must be indication. As I mentioned earlier, if the patient has a heart failure, you transfuse the patient. If there's priapism, there's painful, purposeful erection of the penis, you transfuse the patient. The patient has sequestration crisis, you transfuse the patient. The patient has a plastic crisis, you transfuse the patient. Okay? So we have indications where we transfuse them, because transfusion has its own danger. Okay? You might have overload of transfusion, you might have iron overload, you might have even transmission of a TTIs infection into the patient. So we try as much as possible to see that we cop that and only transfuse when it is necessary for us to transfuse the patient.
Okay, thank you so much, Dr. Ovye. We'll go on a quick break now, and when we do return, Dr. Ovye is still on standby to give us further insights on managing the sickle cell disease in Africa, especially in Nigeria.
Sickle cell diseases is a struggle that many Nigerians have endured for years, as highlighted by the reports from the Sickle Cell Disorder Registry, Nigeria. The high birth and death rates associated with sickle cell diseases in Nigeria are a significant cause for concern. This disease not only brings numerous crises for patients, but also often leads to the breakdown of families with sickle cell sufferers. In light of this, many Nigerians are advocating for a broader perspective when choosing a life partner, suggesting that consideration should extend beyond love and tradition to include the potential impact on future generations.
My advice for people is that before you get married, no matter how the way you love that person, make sure you go for your genotype, for your test.
Residents of the FCT emphasized how sickle cell diseases can be mitigated and what the government can do to assist in this effort.
Yeah, I think just like every other diseases out there, it's better we start with awareness, let me put it that way. Government should have maybe more jingles on radios and television. Government should try to make provision for their treatments and every other thing they might need.
Religious leaders have also been reminded to advocate for genotype testing during marriage counseling and to ensure that couples undergo the test thoroughly.
In terms of religion, the pastors during marriage counseling, that's what they used to call it. They're supposed to educate them before getting married, and if possible, check whether they have already done the test.
Amid this economic crisis and financial stability in Nigeria, an FCT resident suggests that the government improve treatment for financial disadvantaged individuals living with sickle cell diseases.
The way out is just our government should just help us, and if it is by deducting money from their account, maybe someone that is standing for the person, maybe deducting the money in their account every month, maybe by month end. Speaking to a lab scientist, he described the sickle cell disease genotype as one of the biggest causes of family breakdowns in Nigeria, noting that it also consumes significant financial resources.
We've seen several cases whereby marriages are being break down as a result of this scourge called sickle cell disease due to some economic implications. When you have a patient like that in the family, it takes more of your finances. It takes more of your mental well-being. So it is advisable and it is expedient as well that every intending couple should ensure that the genotype testing is done.
Creating more awareness about the importance of premarital genotype testing and making it a compulsory law before marriage registration or copulation will play a vital role in reducing the incidence of sickle cell disease in Nigeria.
Well, I thank God for the age because far from what we know, that's at that time you hardly hear that you see a warrior going even to 30 years. So I'm grateful to God for being for the age 52 years. It has had its ups and downs, sincerely speaking. But the highlight of the pain actually was when I was having my first child. Because of the fear. In fact, I would say so much fear. It was like a horror movie, sincerely speaking, in and out of hospital, and the childbirth itself, because I had a normal delivery. It wasn't a CS, so it was more kind of so stressful for me. It was a season of pain, and because my blood level kept, depleting, going down. So it's like transfusion. Then I was just in and out, fainting, waking up. But to the glory of God, here we are today, down the line. Even after that, 2 more children came. You would have thought that after the first one, I should just go and warn myself. But to the glory of God, I have 3 children, and I've been married for 27 years. Our parents, most of them really were not so aware of this genotype issue, and so they marry based on maybe love or family bringing them together, and then we are the result, and then we cannot do the blame game. Really, it will take us nowhere. But there's more awareness now, and that is why we just solicit for everyone, know your genotype. It will help you to take informed decision. Nobody will take the right of you marrying who you want to, but then we call it informed decision. You know what it is, you know what's the pros and cons of what you're getting into. Then you are informed about what could be and what cannot be. You meet proper genetic counselors. Sincerely speaking, this is not a time that people will keep increasing the number of warriors we are having. It is a time, this is what Sickle Cell did, we actually are making the advocacy, we are pleading with people, know your genotype so that you can take informed decision. It's high time we stopped bringing forth children with sickle cell. It's so painful when you still see 1-year-old child, swollen fingers and all of this. It can be stopped because there are some sicknesses really there's nothing you can do to stop it. But when it comes to sickle cell, knowing it is autosomal in nature, it can be stopped. knowing your genotype will help us to take the informed decision and reduce the scourge of this menace we have in our society. It's actually the stigmatization, because I had, I had leg ulcer for, like I said, 8 years, and I kept tying bandage. Some people didn't know my name in school. You can imagine the names on and on. And because of the weakness, so it was as if, sick like that, the way the word is being used is like a weapon. When somebody is not doing well, when you are falling, when you are like, why are you behaving like a sickler? You're a sickler, that kind of thing. And actually, this ideology that they don't live long. And because God has helped me, I've beaten, they don't live long, they can't give birth. God has helped me to beat that scenario. They can't have children. God has helped me to beat it. It has actually fueled the concept of me having a foundation to say, let's come together. This is what people are saying, but this is narrative. We can come together and change it. And at the foundation, sincerely speaking, God has been helping us. We have been able to manage ourselves. We give our free medications. We say, come and thank God for the way it is. We'll bring them together. We have at least minimum of 130 warriors at every clinic, and we give them all their medications. Like I said, even hydroxyurea, hematinics, folic acid, everything free of charge. I am out to prove that it is not a death sentence if well managed.
Welcome back, and thank you so much for staying with us. If you're just joining us, this is Healthy Living on Trust Television, and on this particular episode we have been looking at managing the sickle cell disease, and we have Dr. Ovye, who has been talking so much about it. Thank you so much, Doctor, for being on standby. Now, I'd like to look at, say, the role of genotype testing in this scenario.
Now, when we do our genotype, it helps us to be able to reduce the burden of the disease. Now, let's look at the aspect of marriage. Now, two young people that want to get married, and then they don't go and do their genital screening, and they get married. Assuming one of them is AS, the other is AS, or AS and SS, and they give birth to children who turn out to be SS. We are definitely increasing the burden of the disease. Now, by the time we go ahead to do the screening, and we find that you are AS, the other guy is AS, and you advise, and then they don't get married, and we keep doing that, then the burden of disease will reduce in Nigeria, in Africa. Okay? Yeah. Okay.
Now, still talking about management procedures, I'd like to, you talked about stem cell bone marrow transplant earlier. I'd like for you to give us further insights on that, and you did say we can do that in Lagos, but how do you factor in the cost here?
The cost is a problem. I think the last time I asked, sometimes last year, before the dollar inflation, it was about 10 to 15 million. It might be up to 20 million now in Benin, when I asked the last time. Okay, and so many people cannot be able to afford that. We those are be able to afford that, children of bourgeois. Otherwise, a poor man cannot be able to afford the stem cell transplant.
Okay, so walk us through gene therapy.
What?
Gene therapy.
Therapy. It's the same thing.
Okay.
Okay. Again, the issue of cost, and then from our own ends here, the technology has not reached our own ends here. Okay. Something you see in the Western world, but definitely not in Africa.
Now, what would you advise to stakeholders alike regarding better management of this disease? We have stated quite a number of management procedures, but then some of them are cost intensive. How would you advise?
Well, the first is awareness, advocacy, and the government itself should understand the plight of the sickle cell patients. Because I speak to you, the willpower is not there. The political power is not there. And it seems, well, nobody cares about them. But the government should come in and support, a program that has to be sickle cell patients that I think will go a long way to be able to assist them and help them in all their treatment management. Okay.
What would you say about stigmatization of these warriors?
Again, awareness is very, very important. These warriors are human beings like us, and I say they are quite intelligent, they are strong people, they are courageous. So we're not better off than them. And so people should stop that, and give them all the necessary assistance and support. And you'll see how great they will be.
It is important that we understand the nature of sickle cell disease, raise awareness and create more support for those affected with the disease in order to reduce the disease burden in Africa and especially in Nigeria. And that concludes this week's episode of the program Healthy Living on Trust Television. For comments, contributions and suggestions, do well to follow and subscribe to all Trust TV social media handles. Download the Trust TV app on iOS and Android devices across their respective stores and get live updates on the YouTube live stream and the website. Join us next time as we continue to explore subjects crucial to your health and well-being. I'm Aisha, Salihu. Thanks for your time.